Nobody wants to think of their beloved pet getting sick. What if there were a way to prevent many of the life-threatening diseases dogs acquire? One of the greatest areas of progress in veterinary medicine in the last 50 years is the prevention of disease through the use of vaccinations. We will discuss how your dog might be exposed to diseases, how vaccinations work, the different types of diseases, and how to prevent disease through vaccinating your pet. Many dog diseases are the result of a specific virus or bacteria infecting your pet. These infections can be spread via close contact with other dogs. Dogs can also contract diseases by being exposed to the feces or urine of another dog. Some viruses and bacteria can even be carried into your home on clothing or shoes. Puppies receive natural immunity to many of these life-threatening diseases from their mother's milk or colostrum. These antibodies help to protect the puppy for the first several weeks of life. Most puppy vaccination programs begin between 6 and 8 weeks of age, when the maternal antibodies have begun to fade. Prior to receiving a vaccine, your veterinarian will perform a thorough physical exam. The evaluation of your pet's physical health and the determination of any existing disease is very important. Once your veterinarian has determined that your dog is healthy and ready for the vaccine, they will administer the injection through a small, sterile needle. A vaccine introduces a safe form of the disease. Each time the pet is vaccinated, they produce antibodies directed toward the actual virus or bacteria. After several boosters given at a 3 to 4 week interval, a puppy's immune system is equipped to fight off the actual disease. Boostering these vaccinations periodically protects the dog throughout his life. One vaccination used routinely for puppies and adult dogs is called the distemper combination. Though distemper is one of the components of this vaccine, there are several other diseases this vaccine protects against. You may notice the abbreviation DHPPC on the vaccine that your veterinarian gives. Each letter represents the name of the diseases it protects against. These include distemper, hepatitis, parainfluenza, parvovirus, and the coronavirus. A sixth disease, sometimes vaccinated against the combined booster, is leptospirosis. Your veterinarian will decide if the leptospirosis vaccine is necessary for your dog. The puppy vaccination series usually begins with the canine distemper combination, given between 6 and 8 weeks of age, and ends at 4 to 5 months of age. By boostering a puppy every 3 to 4 weeks with the canine distemper combination, immunity is established during a time in the puppy's life where they have very little natural disease prevention. These initial vaccines are perhaps the most significant that your dog will receive, so you'll want to closely follow your veterinarian's recommended schedule. After the initial puppy series, this vaccine is administered as an annual injection to adult dogs. Bordetella is another vaccination given routinely to dogs, and it protects against a respiratory disease called kennel cough. This vaccine is especially important if your dog is going to be in the company of other dogs or will be boarding at a kennel or groomer. This vaccination is given as a nose drop or as an injection every 6 to 12 months. State law mandates that the rabies vaccination be administered to all dogs. Although the rabies vaccination is generally given every 1 to 3 years, this will vary from state to state depending on the degree of exposure. This vaccine does not require repeated dosings during the puppy vaccination series due to the highly effective immune response that it creates. Most rabies vaccinations are given initially between 12 to 16 weeks of age. Lyme disease is common in some areas of the U.S. and is vaccinated against in these areas. Dogs that are frequently in wooded areas with lots of ticks should receive this vaccination. This vaccine is given annually. Please ask your veterinarian if this is appropriate for your pet. Mild reactions to vaccines do occur occasionally. Slight lethargy, loss of appetite, or tenderness and mild swelling near the injection site are possible reactions that some dogs exhibit for 24 to 48 hours after being vaccinated. The very small risk of a vaccine-related side effect is greatly outweighed by the benefit of protection against a serious or fatal disease. If a prominent vaccine reaction occurs, contact your veterinarian immediately for recommendations or treatment. Your veterinarian will be able to assess the needs of your pet and administer the appropriate vaccines to provide prolonged immunity against disease. Remember, an ounce of prevention may save the life of your beloved pet.